This exercise demonstrates that the dog will allow a stranger or client in a program to handle him without shyness or concern. This exercise demonstrates that the dog will allow his handler to engage in conversation with other people in a program setting without demanding attention. Walking on a loose lead demonstrates that the handler has verbal control of her dog and that a client will be able to walk the dog safely without the dog pulling or lagging behind. It also challenges the heeling dog to remain focused even while distracted by the down dog. Programs are group activities, and the dogs must be able to stay focused on their work regardless of what else is happening in the room. This exercise demonstrates that the handler has verbal control of her dog and that the dog knows the basic commands that are used in every program. This exercise demonstrates that the dog is under verbal control and is not overly shy or anxious when approached by a friendly stranger, such as volunteers, a client, or medical professional in a program. This sequence of commands is one of the most commonly used in programs. It demonstrates that the dog is under verbal control and can remain focused. This exercise demonstrates that the dog can behave politely around other dogs. The dog is confident at all times when faced with distracting noises and conditions that may occur in a hospital or other program setting. Many programs are held in hospitals, so the dog must be comfortable in close quarters with people using medical equipment without fear or over exuberance. Jumping is an automatic failure. A misplaced paw can cause multiple problems.
Leave it. Good girl. Good girl. Good girl. Yay. Good girl. Okay.
Our clients may be slow to release a ball or a toy or to deliver a treat. These two exercises test the dog's patience,
Okay.
good manners, and ability to await instruction from his handler or a client.
Good girl. Scotch, sit. Sit.
This exercise tests the verbal control of the handler and the dog's obedience with distraction. The long sit is also important in the case of an emergency, when the dog must be trusted to stay where commanded in spite of distractions. Laying down, even in the same spot where the dog had been sitting, is a failure. The dog must remain in a sit until released by her handler. Performed in conjunction with a healing dog in exercise 3, this exercise is called an honor down in obedience competition. It tests the verbal control of the handler and the dog's obedience with distraction.
Halt. Here.
About face.
Here.
Slow.
Here. Good girl.
Normal. Halt. Honor team, return to your dog. Exercise finished.
Good job.
Leave your dogs.
Stay. Scotch. Stay.
This will be a 3-minute tie out. Time will begin now.
This exercise tests the dog's behavior when her handler is out of sight. This might occur in the case of an emergency or as part of a program activity.
Return to your dogs.